Bismillahirrahmanirrahim. Assalamu alaikum. First of all, I would like to thank Mr. XXX who is in front of me, and he has been kind enough to let me shoot this. So I'm very thankful to you, sir, for letting me shoot this video. He has been suffering from a condition that is basically called plexopathy or brachial nerve plexus injury. He happened to this happened because of an accident, and he ran into an accident. After that, he has lost control of his upper extremity on the left side. Now, after that, he went to Aga Khan Hospital, Karachi, and there the doctor performed some nerve transplants and transfers, in fact nerve transfers, and after that he has been coming to me. So I want you to see that the nerve transfer was performed for the bicep, the musculocutaneous nerve, and also some part of the ulnar nerve has been transferred to the opposite median nerve, C7. But right now the complaint was that he is unable to move his elbow correctly and his hand. So I'm showing you the position of the hand. First of all, you can see that there is almost no tone. So you can see there is almost no tone, and if even I ask him or if I request him to please perform any movement, try to move the hand, see he is performing the elbow flexion instead of this, and his fingers are flexed, so it is similar to a claw hand deformity. And can you be kind enough to show us both your hands? Now please, I want you to have a closer look onto the thenar eminence and the hypothenar eminence. This is the sound side, and look at the muscle wasting on this side and this side. So the median and the ulnar nerve are involved. Similarly, if we can have a look onto the nails, I'm not sure if you can see, but this nail and this nail, or from the similar finger, it is a lot different. So the nail bed changes and even the nail changes are there, and this is because of lack of muscle function and blood supply. What we can advise the patient is very important. We can ask the patient to perform the passive range of motion himself or by the help of someone and they can be flexion and extension of the hand and ulnar and radial deviation. Similarly, we can try to extend the fingers. They are a lot tight, you can see this, and we can hold it. We can try to perform this fist making passively, and we can also perform the full elbow flexion and elbow extension. So from this it would be really nice. I can feel the temperature difference over here and here, and we can also perform the electric stimulation. So right now I'll try to stimulate these muscles and see what is the response, and then we might suggest him to please perform the electric stimulation if it works. So let's go for electric stimulation and we will see. Okay, so right now I'm trying to stimulate with the electric stimulation, and I'm using the rectangular surge current. I'm not sure if I can show you this, but let's try to show more clearly. You guys can, I hope you can see this. Let me keep it into focus. Yeah, you can pause this and you can see I have kept the pulse width up to 500 microseconds and frequency of 1 hertz, and contraction time or on time is 3 seconds and off time is also 3 seconds. Similarly, polarity is bidirectional, so it will keep on changing, and it is on CC because the electrodes are not moving. If it were CV, we would be moving the electrodes and we could be using the pen electrode, but right now I'm using the standard electrode, and that's it. So let's try to film it again, and I am going to fix it over there. Yeah, so gradually I'm going to increase the intensity, and I'll try to bring this into, yeah, now this is channel A, so we would expect to see some contraction. Let's see what happens. There is almost no contraction. Are you feeling this? Okay, so let's increase the intensity. So there is no contraction. So let's shift the electrode a bit to the medial side, so that we can expect some contraction. And let's move this a bit proximally, and let's see whether there is any contraction or not. Just 2 minutes. There is no contraction now. So let's try to see if we can stimulate using the direct current. So let's go to therapy guide. Let's go to this electrotherapy, this muscle function. Denervation and 5. Let's go for triangular, and let's see if there is any response. Yes, I can show you something. I'm zooming. There is movement. Let's increase this. You guys can see. Is it too painful? I'm keeping it to about 50 milliampere. I'm zooming out. So this is because it is just for 1 minute, and it can cause skin burn also at high intensity. So let's do it again. Let's keep it to 50 again and see what we can achieve now. And that is exactly at 50 milliampere. So if there is a response to the electric stimulation, let's switch the current to other, and let's see if we can use some other waveform. Okay, so I'm going to choose the neuromuscular electric stimulation surge current. I'll go for monophasic triangular this time, because triangular can achieve the peak and then come down. That would be really nice, because we just want to activate the muscle first. And I'll keep everything to the default right now. Pulse time is about 300 microsecond. We can increase this because this can make a lot of difference. So I'm keeping it to about 600 microsecond right now, and pulse frequency is set to 50 hertz. Let's see what happens. I'll keep it to the same intensity of 50. Let's see what happens. I don't see a response. So let's keep the frequency to 1, so that we can easily see if there is any response or not. Let's keep it to 50 again. Of course, we can perform the Rio base synchronexy. Relax your hand. No, I don't see any movement right now. Yes, but if again I go to select the very same current, that is from improve muscle function 3 and denervation, so that means triangular again. Now for 1 minute, and let's take it to 50. Now this is very important. I can show you the screen also. There is response of this patient only on this sort of electric stimulation, and you can see this. I'm going to zoom out the screen first. This is galvanic in nature. So if we are looking at a galvanic response, that means that the nerve is denervated. So we will make more videos about this, and I will definitely let you know if there is any improvement or how we can proceed. So in my opinion, we can go for an NCS also, we can also go for Rehobase and Conexi, and we can keep on stimulating the muscles. So till next video, I'll be saying goodbye to you, and if you have any questions and comments, do let me know. Thank you.